So Dr. Gayatri Juneja is an obstetrician and a gynecologist practicing in New Delhi, where she has a clinic, Ioni Cure. She has over 20 years of experience and also works at Fortis Hospital, Cloud9 Hospital, CK Birla Hospital. So none to say, like, she is somebody who's super experienced, and we're so happy that she's here for our first Saathi Samvaad. Could you describe the 4 phases of the menstrual cycle and where a period fits into that?
So 4 phases, if we talk about it, we will talk about in 2 levels.
Okay.
One is one which is the control in the brain, and then one which is seen, that is the menstruation.
Yeah.
So initially it is like your follicular phase, which, if we say simplify it, it gives you raw material to grow the egg, and it turns out to be called the secretory phase on the uterus and the ovary. And then comes the luteinizing hormone, luteinizing phase. That's when the ovulation takes place, and that's when it's the proliferative and secretory. And that's when the woman starts menstruating. The woman starts having a period. That's when the menstruation starts. That happens after ovulation. If you say 1, 2, 3, 4, that's the 4th phase, is the menstruation.
So the ovulation phase, and correct me if I'm wrong, is when the egg travels from, it's released by the follicle, right? I'm trying to think back to 10th grade bio, and then it travels through the fallopian tube. And either in the fallopian tube, it can get fertilized. And if not, then there's the lining of the uterus that thickens. So when you have a period, it's essentially, the egg didn't get fertilized. Now that uterus lining, which is thick, is shedding. And that's kind of what we see for a period. I think that's
yes.
what I understood.
So yes, that's more or less, yes.
Okay.
So how we divide it is follicular phases, you're right, we ripen the follicle. Yeah. And proliferative is that follicle ripens, and like how we give for the plant nutrition, we have to make the bed fertilized. That's like we are that the lining of the uterus is growing. That's the fertilization or the proliferative phase. And then the egg releases. You're right, it releases in the ovary, carried through the tube. The pregnancy starts, gets embedded in the womb. If the pregnancy is not there, then the withdrawal takes place, and that's when the menstruation occurs. Yes, you're right.
Okay. What's interesting is that most women, we, started menstruating when we were, during puberty, 13, 14, 15, around before that usually. But there's such little knowledge about it. And I'm very lucky to come from, a background which I had a lot of education, a lot of resources to learn about this. But even then, like, I constantly have to think back to biology and like, wait, why is this happening? So it's always good to get the reminder from somebody who's a professional. But only about 36, and this is kind of the core of the discussion today, only about 36% of women in India, or people who menstruate in India, actually have access to, sanitary pads or other menstrual health products. And, there's obvious risks to that in terms of like cleanliness and hygiene. But from a medical perspective, what are some of the health risks that women pose? And when you hear this statistic of, 1/3 of the population of menstruators, what are some risks you worry about with the population facing?
So first of all, yes, hygiene is a very important thing. And considering the pads and all, they are little expensive. So not everyone can afford it. Now that the government is actually supporting, thanks to our present Prime Minister and the Health Minister, they have actually understood. But still we have a long way to go. So what women, they generally do, first of all, that access and the knowledge that they have to use a sanitary napkin is not there. So what they used to do is like, purana kapde use kar liye, rewash it and reuse it, which is not a very good thing. And if you continue using the same pad for a long time, you see, blood is a very good culture medium, so the infections can develop. So the hygiene part is very important, and changing a pad every 2 to 3 hours, no matter if it's fully soaked or not. Because of the cost factor, the girls, they tend to pura bhar jayega fir fenkenge, which is not a good thing. They end up having rashes on their outer part. So cleanliness and cleaning part is a very important part of menstrual hygiene, and changing pads on time.
How is this related to like a UTI, for example?
I will just make a small diagram and show you. If you can see this. This happens to be our, is it clear? This happens to be our mouth of the If you see, this is the urine outlet, this is the vagina, and this is the potty area. Now, what
Yeah.
happens is if the pad is kept for a long time, and we don't use our hands to clean the backside.
Yeah.
Once we pass stools, we have a habit of using a jet and just letting it be. What happens
Yeah.
with the jet is we don't know, at times stool is still stuck over here. So the bacteria can travel, and the pad gives it an easy access to travel up to the urine area. So that can cause
Okay.
UTI.
Okay. And I'm assuming even the fact that it's a moist surface
Yes.
is more prone to, getting bacteria and that culture. Okay.
Get this. That's what I said. Blood is a good culture media. It gives more
Yeah.
access to the bacteria to grow.
Yeah. Okay.
So
The more you know.
now that we have raised this point, one point I would like to say to prevent urine infection, which girls are really prone for, have lot of water. Whenever you clean the stool, don't use the same hand to clean in front. The cleaning part
Okay.
should be from front to back, not back to front.
Yeah.
So that's
Okay.
a part of a hygiene, because women, they catch urine infection very frequently otherwise.
So do you think that, because you've had 20 years of experience, do you think that this has ever been an issue to discuss with patients? Like, theoretically, we hear about how it's such a taboo topic in India, and it is still today. But is that a problem that you face in your clinic as well, when people are coming in but just not telling you what they're facing?
At times, but I feel like when we started our practice till today, things have actually changed. Now, even fathers are getting their daughters for their menstrual problems. So I'm happy to see that actually. Previously, when we were young, our grandmothers used to say kitchen में नहीं जाना और अचार को हाथ नहीं लगाना, मंदिर नहीं जाना, and I used to wonder why. Because क्या हम अछूत हो जाते हैं कि ये गंदा खून है. But I would like to reassure everyone that the periods, having menstruation, is nothing to feel bad. We don't become untouchables. It's just that in older times, women used to do a lot of physical work. Plus, when they're having menses, they become vulnerable, tired, and so that was a forced time when they could have some rest. So it's not that they become untouchable. Achar nahi khana. Why? Pickle has a lot of salt. So that causes water retention and may pain in your periods and excessive bleeding. That can cause that. So these are very little things we have forgotten why, but we remember कि करना है, which is not actually a good thing. So you can always enter temples. I mean, I am not trying to, people should not get offended.
Yeah.
Women, they don't get, I mean, it's a very controversial statement. I don't want people getting offended, but अगर आप देखें कामाख्या देवी मंदिर है where they celebrate menstruation, where they say goddess has periods. So it's nothing to do. A woman does not become untouchable. Movies like Padman, they have also made a lot of difference.
Yeah. When I was growing up, I came to the US for college, so I moved here pretty young when I was about 17. And till then, I'd only ever, used a sanitary pad. I'd never used other forms of menstrual products. Probably because I think in India, there's also this taboo about insertion. And so tampons and other products aren't really available at all. And, I continue to still just use pads more out of habit. Do you think there's any advantage in using product A over product B? Are there certain products you'll tell people not to try, or some that you think are beneficial?
See, whatever makes you comfortable. The purpose is that you should feel comfortable using it.
Yeah.
So tampon is as good as a sanitary pad. It's as good as a menstrual cup. Yeah. Provided you are changing your pads and tampons and your menstrual cup, you're cleaning on time, everything is good.
Okay. No, that's good to know, because again, like for somebody who's still learning and trying to understand, okay, what are the different products out there? I think that, again, getting an opinion that says, all are actually the same. It just depends on what you're comfortable with is
Yes.
good. Just switching the conversation a little, and I don't know how beneficial this be for the audience, but it is for me. I want to understand more about PCOS and PCOD. So PCOS being polycystic ovary syndrome, and PCOD being polycystic ovarian disorder, I believe. How are these related to periods? What are the symptoms? What causes them? And if somebody feels like they may have them, what are the treatment options out there?
So PCOD was initially the terminology we used to use. Now it is called PCOS. It's a polycystic ovarian syndrome. Because it is not a disease, it's a lifestyle disorder.
Okay.
And what most common symptom is having menstrual irregularities, weight gain, acne, hirsutism. So if you feel your pattern of period is changing, either you're skipping your periods or you're having acne or the flow is getting very scanty over a period of time, you're putting on weight, or you're having unnatural hair growth, unnecessary. I mean, fine hair growth on the face is fine. But if you're having coarse hair growth like beard or something, at times it might not be so obvious. It might be just one or two hair,
Mhm.
but your periods are getting haywire. That's when you should think you might be having PCOS. And why we call it as a syndrome is because not only the periods, it also affects your metabolic conditions like blood sugars. It can affect your heart and blood pressure, so many other. That's why we call it a syndrome.
Okay. Got it. And what are the
And
treatment options
lifestyle
out there right
is the
now?
major precipitating factor. Bad lifestyle. Eating a lot of junk food, not sleeping on time, not exercising, having very high stressful life.
And
Yeah.
what are the treatment options that are available right now? Is it mostly
So if you
medicinal or
take
is
from
there
A
anything
to
else?
Z, A to Z, it is lifestyle. Anything, once your lifestyle is settled, only then it will work. Medicines, of course, at times, depending on what's the cause of your
Yeah.
PCOS. If your hormones are irregular, like your male hormones, like women usually have little amount of testosterone. If it goes little more than normal, we need to treat that. So it all depends on the whatever irregularity, but mainstay of treatment is lifestyle
Okay.
and your food habit.
Okay. And what's the usual pop age group? I think I'd heard of a lot of people getting it around their when they're 16, 17 years. Is that the usual age at which somebody's diagnosed, or does it carry on till people are more mid-aged?
Usually it happens when the girls, so what happens when the girls start menstruating is the period, our blood hormone levels are still not in a mature level. So at times you
Yeah.
might have irregular periods, but as the girl matures, the period sets in normally and everything goes well. It is mostly seen in 20s, and yes, it can carry on in 30s as well as.
Just to kind of wrap up, for most adolescent girls who are, let's say, between 18 to 25, what are some of the biggest risks they pose, or rather, what should they just be looking out for at this age? And also, how often should we be coming to gynecologists? And, even if we come to a gynecologist, what tests should we make sure we're getting done?
So for a young girl, if she's sexually active, so she has
Mhm.
to take care that contraception is a very big thing, and best is to use double protection like condom, barrier contraceptive to prevent from sexually shared infections, and oral pills because at times the condoms might not work, it might slip or whatever burst, or the partner might not agree. But a dual protection is what we tell the girls you should follow. And no, I don't mean emergency contraceptive. Emergency like that eye pill over the counter should not be taken. If you're regular in your sexual activities, please go for regular pills rather than your emergency contraceptive, because that has a very high dose of hormones and that can precipitate PCOS. If she has any excessive vaginal discharge which is foul smelling, or it's causing itching or staining her panties, she should see her gynae. Any period problems are there, menstruation problems, excessive bleeding or scanty flow, or she sees there's discharge from her nipple, or a breast examination we should do every month once our periods are over. I can take another class on how to do a regular breast
Yeah.
examination. That's very important because breast
Yeah.
cancer is again rising a lot. And most
Yeah.
important is to get vaccinated for cervical cancer. Here I would like to say that a new vaccine has come up where it is covering 9 subspecies of the human papilloma virus, which is
Yeah.
responsible for cervical cancer.
And they say that you should take the cervical cancer, the vaccine, usually before you're sexually active. I know that in a lot of countries,
Yes.
they make people take it, by the time they're 14, 15. But what is it in India? Is it something that the government kind of pushes, or do people still have to go to a doctor or a gynecologist and get it done over there?
So far it is not yet, but I think by this year they will take it in national immunization program as well, and an Indian variety will also come in the market. So ideally, the girl should be vaccinated between 12 to 15. It is 2 doses. Beyond 15, it is 3 doses. So even if you're sexually active and you've not done, get a pap smear done and then get yourself vaccinated.
And a pap smear should be done every year?
It depends on how what is the age of sexual activation. If she's 5 and above, then we do it every 3 years till the girl or the woman turns 50. Beyond 50, it is every 5 years. And we can do it even earlier if a woman is sexually active earlier also, say 17, 18.
We just got a question. I want to address it. Somebody's asked, is a 2 day of period normal?
See, if she's been having it since beginning, then it's fine. Depends if the flow has changed or suddenly, or I mean, if it's a very new thing, then yes, she has to take care. If she's been having it regularly 2 days only, then it's fine, doesn't matter.
Okay. So, my last question to you, doctor, in the meantime, we'll also see if somebody else asks anything. But my last question is, and I think we kind of touched on this, but every time a person gets their period, it's a little different, whether that's the consistency, whether that's how many days, right? The color, it all kind of varies a little bit. But what are some major red flags when it comes to your period that somebody should be looking out for? So at what point, if a girl who's 14, 15, right, is like, okay, this happened in my period, I should go to a gynecologist, versus just dismiss it at, okay, it may just be this time?
So once a girl starts menstruating, if she has a period and then does not have period for another few months, it's okay, because it takes time for the cycle to set in. But if she continues to have her periods which are like more than excess, she has to change a pad every 2 to 3 hours and is fully soaked. It's like a tap opening, and or maybe big clots. That's when a girl needs to see a doctor.
Okay.
Or maybe if the periods were fine and suddenly they're not there. Suddenly scanty are not there at all. Then also.
Somebody sent me a message and they said, if I get periods twice a month, is that okay?
So see, it depends how you're calculating your period. At times a girl has a period on 1st of the month, and after 28 days, say 27th or 28th, she's having a period again, which is perfectly fine. But for her, she's having it twice in same month. So how we calculate our period cycle is ask them to keep a check with day one of, say suppose in March she had on 1st March, then 30th March perhaps, then in April when is she having. So for 6 cycles, let her keep a check, then she'll have an idea. We take the time duration from first day of period to next first day of period. That is how we calculate a cycle. It's not the ending of the period cycle, it's the beginning.
Yeah. But let's say somebody's period starts every like 2.5 weeks. So they're only, not menstruating for a week in the middle or something. Is that something
no,
really,
that's not
concerning?
Good. That's not good. There has to be something,
Okay.
That's
so
called
I would
recommend,
I think. Yeah. So if somebody has something like that, they should definitely visit a gynecologist. Okay. Got it. Got it. Okay. I am done with my questions. Anything else you want to add, doctor, do you think our viewers should know? I think this whole session was super helpful. I'm definitely going to rewatch it to make sure I didn't miss anything important.
You guys can message me if you want to ask anything.
Yeah. So your Instagram is Ayoni_cure. So AYONI_CURE. And we'll also add it to the bio when we save it on our profile. But besides that, thank you so much. Hopefully I'll get to see you again soon. And once again, thank you for taking out the time.
Thank you. And I think you guys are doing wonderful. We need that biodegradable sanitary napkins. Thank you so much.